So good morning, everybody. This is Gary Pace, the Public Health Officer for Lake County. It's Tuesday, February 16th, and this is our COVID update. Things are continuing to improve in the county. We're continuing to roll out vaccine in the county, and we'll have Sarah give the specific updates, and then I'll talk about some of the issues that are going on. So Sarah?
Good morning. I'm going to provide a brief update. As of yesterday, the testing positivity in the state of California continues to decline. It was 4.3%, down from about 15% just a couple of weeks ago. On the left, we're looking at the number of new tests reported statewide. The dark blue line is the 14-day average. Testing continues to decline statewide, but still remains relatively high. So this is really promising news that we continue to see a relatively high rate of testing and a lower rate, a declining rate of testing positivity. As of yesterday, the state reported 3.4 million known COVID cases. Fortunately, we continue to see a dramatic decline in the number of new infections, down to about 6,500 new cases identified yesterday. Correspondingly, we see the decline in the number of COVID hospitalized people, down to less than 10,000 statewide yesterday. And then we continue to see the decrease in our ICUs, our intensive care units statewide. So about 2,600 people with COVID were in the ICU statewide yesterday. We've identified 47,000 COVID deaths in the state of California since the beginning of the pandemic. And here we'll take a look at what's happening in Lake County. We continue to identify fewer cases. In the last 7 days, we've identified 85 new cases for a total of 2,970 cases. We have had 3 new deaths in the last 7 days. The good news is that our case rate continues to decline. However, Lake County will remain in the purple tier, indicating widespread transmission for the next week with a daily case rate of about 20 per 100,000. But that is significantly down from the holiday period, the New Year period, when our rate was up more closer to about 60 per 100,000. I want to briefly give you a vaccine update. About 8,300 people have received at least 1 dose, and this is about 13% of the county population and about 16% of the adult population. And now the California Department of Public Health is reporting vaccine data on their dashboard. We've provided the link here below so you can track it daily if you're interested. So as of yesterday, here's the breakdown by age and who in Lake County has received at least 1 dose. So 67% have gone to people 65 years of age or older, 14% have gone to people 50 to 64, and about 18% have gone to people 18 to 49. And here we're looking at the same data, but by race and ethnicity. So here on the left, people with at least 1 dose of vaccine, about 62% were white, about 10% were Latino, and you can see the other racial ethnic breakdowns by doses administered in the county. And then lastly, this is by gender. About 58% of people who've received a dose are female and about 42% are male. These data roughly reflect the populations that were prioritized in this first phase. So this, were people in skilled nursing facilities who are at high risk, healthcare workers, other emergency service workers. So we'll continue to report and track these data. And then lastly, just want to add that as we review the vaccine strategy, we've been looking at people who have been at the highest risk for death in the county. And we're seeing two fairly distinct groups. We're seeing an older, significantly older, people over the age of 75, mostly white population. And then we're seeing people of color who are younger, under age 65, who have been at high risk for death. When we look at deaths not associated with skilled nursing facilities, so deaths that occurred in the community, about 58% have been among white residents. Over half of those have been over the age of 75, and about 42% of deaths have been among people of color, or 2/3 of those have been under the age of 65. So we're continuing to look at that to help inform our vaccine strategy to reduce mortality among high-risk populations. Thank you.
Thank you, Sarah. So there's a lot in there. We're continuing to improve the case rates now, about 18 per 100,000, which is below the 25 per 100,000 threshold that allows the elementary schools to open if they're prepared. So there's a lot of movement amongst the elementary schools in the county to go ahead and make plans to open up, because at this point they are allowed to do that as long as their safety plans are in place and they have all their kind of plans coordinated and ready to go. We continue to be in the purple tier. We'd have to get under about 43 cases per week to get into the red tier. The test positivity rate, there's two variables that matter, the test positivity rate and the case rate. The test positivity rate is now 6.7%, which is adequate to get us into the red tier, but the case rate is still about twice what it needs to be for us to get there. So we need to continue to see some decline before we're going to be ready to move into the red tier. The vaccine data is really interesting. So 8,300 people or somewhere around there have gotten their first dose now in the county. So that's 13% of the total population, 16% of the adult population. So we are making progress. It's slow. It's much slower than we'd like. And 2/3 of the vaccine have gotten to people 65 and older. I think the big question that Sarah was kind of talking about a little bit there at the end was what's happening with the ethnicity, with the demographics of the people who are getting the vaccine. At this point, about 10% of the people who have gotten it are Latino, and Latino folks make up about 20% of the county population. So that's a little bit concerning. Part of what's happened is because of the way the state tier system is rolled out. The Latino folks tend to be underrepresented in the nursing homes and the healthcare workers and those kind of things. So we are trying to incorporate that into our planning on who's going to get the vaccine. A couple things about the data that are on the state website and that Sarah showed is one, there's a group that's called multiracial, that's 20% of them. And so there's something funny about the data there, because that's not really, we don't normally think of the county population having 20% being multiracial. So something happened there. And it says 0.4% of the people who have gotten vaccine are Native American. And I suspect there's a problem there. So we're going to explore that a little bit more, because a lot of people have been getting vaccinated through tribal health and that are Native American, and I'm not sure that got reflected in the data. So we're going to explore that a little bit. But overall, things are moving along. We're continuing to get doses, 1,000 plus a week now. Sutter and Adventist have not been getting much vaccine lately, but I think that's going to change in the very near future here. So we're looking forward to increasing and accelerating the movement towards getting the vaccine out to people. The biggest issue, again, is that we've not been getting enough, and so it's just a slow process. But we're preparing for this increase and for opening up of the spigot from the state and the federal government. We're switching now. We actually just switched yesterday from the old setup, which was indoors 2 days a week in Lakeport on Tuesdays and Wednesdays, and 2 days a week in Clear Lake on Fridays and Saturdays. That has now ended. We've now moved to a drive-through strategy. So people are going to be able to drive up, stay in their cars, get their shot, and wait in their cars to make sure that there's no bad reaction, and then they can go. So it's the reason we're doing this is we want to be able to expand, and as we get more vaccine, just to be able to get more people through. In the indoor sites, it was just getting too crowded with as many people as we were seeing. So we had to make this switch. So if you went to one of the indoor sites for your first dose, your second dose is going to be at a different place. It's going to be at one of these outdoor drive-through sites. And you should get a phone call, but if your time comes and you have not gotten a call about where to go, don't go to the same place. If you were in Lakeport, go to the drive-in theater. If you were in Clear Lake, go to the Redbud Park. Those are going to be where the two sites are. In Lakeport, it's going to be on Mondays and Tuesdays. In Clear Lake, it's going to be on Thursdays and Fridays. No more Saturday clinics. You have to have an appointment though. But if you are getting your second dose and you haven't gotten a call, we'll have to figure out how to hook you in. But there is going to be nobody at the original site where you got that vaccine. So the appointments are a big question, and it's a problem. The state is shifting over their appointment scheduling strategy. So we are trying this new platform that we're supposed to be using, but we had a lot of problems with it yesterday. So we're going to go back to the old platform for this week and see if they can fix some of these things by next week. So it's going to be a transition period for the next couple of weeks. It's really on the state to fix this stuff. They're making everybody statewide do it. And basically what it did is it allowed everybody from out of county to make appointments. And we're not getting enough vaccine for the folks in our county, so we can't be providing it for people outside of the county. So we had them cancel all those appointments for people out of the county that had made appointments, and we're kind of shutting that process down, opening up the old process again, and going to move forward for the week. So unfortunately, this week is going to be very chaotic between them moving to the new sites and moving to the new scheduling platform. Is just going to be kind of problematic, but I encourage people's patience and really appreciate it because we're scrambling hard to get this whole thing going. So at this point, to make an appointment, you go on to the Lake County Health Department website, you find the links there, and you connect to the link, and you can go ahead and make your appointment. Now, this is only for 65 and older. If you're not in that group of 65 and older, we're not taking appointments right now. We're just going to get through this week, and then we're going to move through some of the other groups here in the near future. So there have been a lot. We've been getting some lists of people that qualified in the 1A group, but maybe they got missed, or maybe they changed their mind that they want to do it. We're trying to make lists of those people, and we're going to open up some special clinics for that, but it probably won't be till next week now because of all this other that's going on. So if you're in one of those groups that you think you should have been vaccinated because you qualify, but you hadn't been contacted, or you've changed your mind and you want to get the vaccine now, go ahead and send us an email at the MOAC email. So MHOAC at lakecountyca.gov, and we'll put you on the list and try to get you in as soon as we can. We want to get you vaccinated. So it's just trying to manage all these logistics right now. We're having to just focus a little bit. So the current phase that we're on is focusing on the seniors, 65 and older. There's a lot of questions about other groups in this. And so again, partly what's happening is because there's not enough vaccine, we're having to focus on the highest priority groups and get the right people in the front of the line. So the group 1A, which is the healthcare workers, EMS, nursing homes, all those folks, if that basically, we think we've offered that vaccine to everybody in that group. If you've fallen through the cracks for whatever reason, email us, we'll put you on the list, and we'll get you in a clinic probably next week. Then the 65 and older, that's the group we're working on right now. We're making good progress, but we have a ways to go. And so we're just going to keep plowing through there. So the food and ag workers are the next group. And we started to try to work with some of the farm workers this week, but there were some glitches and not everybody that was getting the appointments seemed to be the people that we were trying to target. So we've stopped that and we're going to try to figure out a different way to do that. But again, it's probably going to be another week or two. And the food workers are on our radar. We're trying to get that set up as well. So we're just trying to move through all this. But so the food and ag workers are probably going to be opened up in the next week or two to try to get them vaccinated, because those are the essential workers that are out there keeping us fed during all this. Then the next group is what the state came out with a guidance last week. And so starting March 15th, the folks that are 18 to 64, but that have certain medical conditions are going to be able to get vaccinated. So the state's holding off until the 15th of March, so about a month, and we'll be able to start vaccinating those folks then. I encourage people to go start talking to their medical provider and see if they qualify, because there's certain conditions that the state lists that qualify. You can go on the state website for that and see if you qualify. If you do, we're probably going to need to have you get a letter or something from your provider, or we'll just get you through your medical provider to get the shot. Again, that's still a couple weeks away, but that is coming, and I know there's been a lot of interest in that. After that, probably it's just the way the state's talking now. It's changing a lot, but the way they're talking now is it's just going to go to an age-based setup. So it'll go like 60 to 65 and then 55 to 60, that kind of thing. So probably after that, all the job-based focus is going to disappear. But again, the recommendations are changing a lot. There's a lot of movement, and just encourage you to keep checking in, and we'll let you know when that's changing. So you have to have an appointment to get vaccinated now. Don't show up at the site without an appointment, unless you're a person that's getting a second dose and it's your day to get it and you haven't gotten a phone call. Then we probably will need to figure out how to deal with you then. So to get information, again, a lot of this is changing. We're going to be giving updates twice a week with these videos and or the Board of Supervisors meeting. But since there wasn't a board meeting today, we're doing the video, and we're doing press releases at least once a week. But you can also get information by calling 211, or you can call the Mohawk line, which is 263-8174, or you can email us at the Mohawk line, mhoac@lakecountyca.gov. And the other thing you can do is, if you're an older person, 65 and older, and you qualified for the vaccine, but you don't have a way to do the online appointment scheduling, then if you either don't have internet access or you can't really navigate that, go ahead and call us at this number, which is 993-4644. And somebody there can help you make an appointment. They can kind of schedule you online. Now, if you go online and there's no appointments available, don't call that number. They don't have any extra appointments, but this is for people who don't have the ability to do it through the computer, and it's to make sure that we have access. So we're working on all these things, and I know there's a lot of information and it's changing every week, but we're making some progress, and we'll continue to do it. The vaccine site yesterday was really smooth, and we have the ability to expand quite a bit more in capacity. So I think as long as we keep getting vaccine, we're going to be able to get this through. The biggest glitch now is not having enough vaccine and this problem with the state appointment scheduling and data software. But they're working on all that, and hopefully within a week or two, they're going to get it together. The same thing happened when the testing was rolling out, and eventually the state got it together, and it's working really well now. So it's just, it's a big rollout, and they've got a lot of people working on it. So the last thing there's two more things I want to talk about. One is we did put together the ethics committee last week. So they met for the first day on Tuesday. There was a press release that went out at the end of last week. They're going to meet again today. They're basically helping us to think through some of the vaccine prioritization. The state's got very clear guidelines once they sort of go back and forth with their waffling, but once they sort of settle on things, it's pretty clear, and we're following those. But there can be some sort of unusual exceptions, or there may be some specific things for the county that we need to think about. And so this group is helping us. It's a very professional group, and I really appreciate their willingness to work with us and to sort of manage some of these questions. If you have something that you would like that group to consider, so say you feel like there's some specific need in Lake County that's not being addressed, or that you're representing a group that's not being thought through properly, you can write a short email and send it to the MOAC email site, and then we'll compile all those together and give it to the group when they meet. So that's a way to have some input into them. And the last thing I want to talk about is a little bit about the variants. So you're probably seeing some things, some information about these variants, and I've talked about it a little bit. These are the mutations of the virus that are spreading in different places around the world that seem to be potentially more contagious and potentially more dangerous. So there's 3 ones that they're calling variants of concern. And these are the one in South Africa, the one from the United Kingdom, and the one from Brazil. 2 of those are being seen in California now, and the one that's in London, and it's in the UK, they call it the B117. We're finding a lot of it down in Southern California. There's something like 1,000 of these confirmed cases around the country so far. And clearly it's moving through, and a lot of the virus experts feel like this is going to become the one that's most prevalent around the country. So you'll hear more about this. We're going to be learning more about it, but it's called the B117, or the UK variant. And this seems to be more contagious, and it seems to be more dangerous. So we don't have a confirmed case up in Lake County, but that's not unusual because it's difficult to test for these, and they're really only testing like 1 or 2% of all the tests that are being done are being tested for these variants. So, but be tuned into it, and it's probably going to be up here before too long. They're saying that by March, they think it's going to be the predominant variant throughout the whole country. The South African variant is also been found in California. There's been a couple of cases found in Santa Clara County, so there's certainly more. And this one, the main concern with this one is it seems to not be as the vaccines that were currently in use are not as effective against this variant as it is against the other ones. So you've seen, like in South Africa, they've actually discontinued some of the trials of some of the vaccines because it's not as effective. I think from the point of view of public health and of kind of advocating for the health of the community, definitely get vaccinated. If you have the ability to get vaccinated, go ahead and do it. There's no advantage in waiting because of the variants. I mean, it's possible we're going to have to do boosters down the road, but almost for sure there's going to be some partial immunity, even if it's not complete immunity, with the vaccine that's available now. So by getting vaccinated, you're very likely slowing the transmission of these variants. And we're really trying to get the vaccine out as quickly as possible. It's a little bit of a race to vaccinate people before the variant really gets the strongest hold. Then the last variant of concern, the 3 that are the variants of concern are the South Africa one, the UK one, and this one from Brazil. At this point, nobody's found any of the Brazil variant in the US, but that could be changing anytime in the near future. The one that has been found up here is they're calling it the West Coast variant, or Cal .20C. So this is, you'll probably be hearing more about this. They're calling this a variant of interest. So this is a level down. Variant of concern means they're really worried about it, and we're watching it closely because we think that there's going to be problems with it. The variant of interest is sort of related genetically to the other ones and seems to be related in the way it spreads to the other ones, but we haven't really identified that it's worse off clinically, or that it spreads faster, or that it's more dangerous. But we have seen this in Lake County. We've seen it throughout. That something like 25% of the cases that have been tested for genomically have been identified as this case in California. So we're going to see more of this. Whether that makes a big difference or not, we don't know. So all this is to say, the recommendations stay the same, only even more so. Everything is getting better in the county and in the state in terms of cases, in terms of getting ready to open schools, in terms of the hospitals are doing well, the death rate is slowing down. All this is very good. These variants increase the risk that things are going to be different in the future, that we may see a surge in cases. Vaccination is a really good idea. The sooner you can get vaccinated, the better. And I know it's frustrating because there's just not enough vaccine, but we're getting it in as quickly as we can and getting it out to people as quickly as we can. And wearing masks clearly helps. Even if you've been vaccinated, you should continue to wear masks because it's still possible you can get the infection and spread it. The CDC is now recommending increasing the security of the mask. So either use double masks, wear a surgical mask first, and then put a cloth mask on top, and make sure that the tightness around it is good. So the more we can do that, the safer it's going to be. Keep the social distancing, avoid the socializing out in the community as much as possible with people that aren't in your household. All this is kind of moving forward with the same way, but I think we're really seeing a real improvement now, and that we're really starting to move into a new phase with this virus and with the virus in our life, to where we can get back to some version of normalcy in the coming months, as long as we continue to be careful and use some of the precautions that we've been using all along. So thank you very much for your patience and your cooperation in all this.